only do parents leave the hospital with a baby, but they leave the hospital with a lot of questions. What if your pediatrician came to your house these first few days and helped answer these questions and get breastfeeding right from the start? In those first few days, getting out of the house can feel impossible. And that's why we come to you. First, think about it for the baby and the mom. Mom just had a baby. So her body's uncomfortable, her body's tired, her breasts probably are tender, and then the baby always seems to poop or pee right after you change its diaper. You might want to take a nap, you have to wake the baby up from a nap, might be fussing right when it's time to go. You guys might not know how to use the diapers, change diapers well. You don't know where your diaper bag is, you might not know how to use the car seat. So all of this us coming to your house takes so much stress off your load. And then think about the safety. Most practices in town have a waiting room full of kids, many of them sick, and you're gonna bring a brand new baby into this room? And then what if your doctor's not running on time? Do you wanna wait 10, 15, 20, 30, maybe even 45 minutes in a waiting room with other kids that could be sick, giving things to your precious new baby? So these are two big reasons why home visits matter. And then once we're at your house, how does it work? Well, it's pretty simple. The family greets me at the door, we say hi, we see how it's going. Oftentimes they give me a fresh brewed cup of coffee, which is an awesome perk. We decide where we're gonna set the scale, usually on the coffee table in the living room. And then we decide where we're gonna check the baby out. Often it's on the sofa or on the changing table. And then we get started. We measure the baby's height, length, weight, head circumference. I review all the data from the hospital stay and ask any questions if there's anything concerning, like a long labor or extra bleeding or some trouble with nursing at the hospital. And then we review breastfeeding. Does it feel comfortable? Is it hurting? Do you feel like your milk's coming in? Are you uncomfortable? And then usually we can watch breastfeeding happen right at home where the magic's happening. And we look at the latch, how the mom's holding the baby, and I can make little subtle adjustments, maybe try this, maybe get the baby on like this, maybe hold this way, maybe try football or cross cradle or a different way. And often little adjustments can make a huge difference. And you're not trying to breastfeed in an office, which sometimes is all you can do, but you're at home breastfeeding exactly how you normally do it, which is so much better than in the office. So that's two big reasons. Is one, just an awesome exam at home in the comfort of your home, and two, we get to see breastfeeding and the home environment and make small adjustments as needed. So after the physical exam and after talking about breastfeeding, we'll talk about how people are doing emotionally. Having a baby is a new thing and you're not sleeping. You may or may not have help. So review all these things. We make a plan. We make sure that the breastfeeding parent is focusing on breastfeeding and sleeping, that if there is another parent, that they're focusing on laundry, dishes, food. And then we also go into follow-up. If things are going great, hey, maybe we'll see you in 4 or 5 days. But if things are going difficult, you might have to come back just in 2 days. For example, if the baby's weight's not going up, if breastfeeding's really hurting, if the milk doesn't seem to be going in, myself or Christy, our nurse, will be back in 2 days just to make sure things are headed in the right direction, because we don't want to fall behind here. Some additional things we can do at home is during the fall or spring or winter, we'll do the RSV shot at home if parents want that for extra protection. Sometimes we'll need to do vitamin K shots or the oral vitamin K drops at home to prevent any bleeds. But if something there needs to be more intervention, say like a tongue tie clipping, we will do that in the office for safety purposes.